Hello, welcome to another episode of Gandhian Voice. I am Dr. Mukundan, former Principal Scientist, Agriculture Research Service and former Director, CFRD. Like all of you, I was also surprised to see the havoc played by the virus and its infection, the COVID-19. The helplessness of the authorities all over the world before COVID-19 prompted me to study in detail the disease and the virus SARS-CoV-2, popularly known as coronavirus. Many studies are reported on the etiology of the disease, the nature of coronavirus, the effect of various physical and chemical parameters on its multiplication, survival, and lethal temperatures. Some of these studies give us some useful clues for the management of COVID-19. COVID-19 started in Wuhan in China sometime in December 2019. Within 3 months, it has spread across the globe, and on 11th March 2020, the World Health Organization declared COVID-19 as a pandemic and a global threat to human health. According to WHO, the typical symptoms of COVID-19 are fever, dry cough, fatigue, sputum production, shortness of breath, sore throat, etc. The early infection shows the presence of the virus in the oral and nasal cavities in the first few days. As the infection progresses, the virus spreads into the throat, the trachea, and the bronchioles, which for patients with comorbidities may result in death. As per the World Health Organization and the etiology of the COVID-19 virus, it is pretty clear that minimum 1 week time is available for the first symptoms to severe disease. This 1 week time is good enough for COVID-19 management. Death is rare in normal human beings, but significant in individuals with comorbidities like diseases of the liver, the heart, the kidney, cancer, etc. In such cases, death may happen in 2 to 6 weeks from the date of the primary infection. As on date, many nations are working on an effective vaccine against COVID-19. Even though diverse claims are there on the imminent release of a successful vaccine, there is no definite indication when it will be available in sufficient number for immunizing the world population. As on date, options available for containing the COVID-19 are the social distancing, the use of mask, hand washing, hand sanitizing, etc. There are also immunity boosting options by various medical systems like allopathy, homeopathy, Ayurveda, etc. Till date, no medicine or no method for treatment of COVID-19. In the absence of a scientific remedy, the continued lockdowns, curfews, and other restrictions enforced by the governments and health authorities has badly affected the economy of almost all nations without any relief on COVID-19. The panic and fear created by the pandemic has idled the general public to such an extent that the productivity and economy of many nations are at rock bottom. The situation is very grim, as there is no idea when the situation will be relieved. According to latest statistics, India is the second most affected country with 65,126 new COVID cases and 886 COVID deaths per day as on 16/10 2020. Out of curiosity, I looked into the death statistics in the past several years in India. The average normal death per day in India is around 27,000 people in a year. The death is about, and in a year, the death is about a crore people. And with COVID around, there is no significant change in the death rate. In this background, the death of 856 people per day in India attributed to COVID-19, which obviously is also due to comorbidities, is a matter to be thought twice. Then, making hue and cry about COVID-19 sounds a comedy. Obviously, the fear of the pandemic is a media hype and without any scientific basis. Some well-known professionals in Europe and America, medical professionals in Europe and America has challenged the fake threat of COVID-19. Let us also look into the properties of COVID-19 virus. A thorough study of the scientific literature on SARS-CoV-2, the virus responsible for COVID-19, revealed that this virus is killed on exposure to a temperature of 56 degrees centigrade for 5 minutes. These studies also showed that temperatures above 37 degrees Celsius are also lethal to coronavirus. 5 world famous research institutions like the University of Marburg, Germany, the National Institute of Infectious Diseases, Japan, etc., under the World Health Organization, and half a dozen well-known research institutions all over the world has established the fact that the coronavirus can be killed at 40 to 56 degrees centigrade. A consolidated data on these research findings is available in the world famous publication Public Health Emergency COVID-19 Initiative, published by Wiley Public Health Emergency Collections. Another important biological finding is that the human tissues of oral cavity, the throat, the sinus, etc., can tolerate temperatures up to 56 degrees Celsius, whereas the trachea and the bronchial tissues of lungs can tolerate a temperature of 45 degrees Celsius and a relative humidity up to 100% without any significant physiological changes. These research and scientific data show a substantial possibility of controlling COVID-19 pandemic by exposing the oral and nasal cavities and the throat to a temperature of about 40 to 56 degrees centigrade. The incorporation of a harmless antiviral agent like hydrogen peroxide into the aspirated steam can further speed up the antiviral property of the water vapor at 40 to 56 degrees centigrade. This temperature can be easily achieved by traditional steam inhalation technique to cure early COVID infection. A handful of doctors and other health workers engaged in COVID care have come up with success stories of the use of this technique to tackle the COVID-19. In case the COVID-19 infection reaches the lungs showing symptoms of breathing difficulty, the patient can be put on ventilation with inhalation gases at temperature around 43 to 45 degrees centigrade and a relative humidity of 80%, for which the ventilators are well equipped. The ventilation temperature and humidity can also be selected as per the patient's tolerance. In fact, the temperature and humidity controlled ventilation can be a very effective scientific tool to control most of the respiratory infections, as these temperatures are lethal to many of the pathogens of respiratory tract. This can save the people from the use of costly antibiotics, the toxic side effects of antibiotics, and the threat of antibiotics in nature. In fact, the high fever with body temperatures of 40 degrees Celsius and above observed in different infections is a temperature based natural defense of human body to kill the invading pathogens, while fever affects the entire body including sensitive organs like brain, liver, kidney, etc., which are harmful. The steam inhalation can be applied selectively to get the desired temperature at selected locations like oral and nasal cavities, throat, trachea and bronchioles also, without affecting the temperature of sensitive organs. Why the World Health Organization and other professional agencies in medical and healthcare are not taking this scientific clue to control the pandemic is a surprise for scientists like me. There is no doubt that vaccination is a good option for selective control of this pandemic, provided the virus do not undergo mutation. If mutation takes place, the situation will become still complex. But until a successful vaccination becomes ready and feasible, why the health authorities are hesitating to use this least expensive but more promising technique of inhalation of a mixture of steam, hydrogen peroxide and pure air at a temperature of 40 to 56 degrees Celsius to control the COVID virus. The possibility of eradication of COVID-19 by a planned steam inhalation for 5 minutes 3 times a day for a week by the entire population of the country is worth trying. This is a scientific hypothesis for the consideration of the health authorities and ruling politicians. I am sure it can manage the COVID-19 and there is no reason to panic and lock down. Thank you all.